The United States has the most expensive healthcare system on Earth, and some of the worst results of any wealthy nation. How is that even possible? That's what this video answers. Not just how much it costs, where the money goes, how the system was built, and why it keeps getting more expensive every single year. It starts with three layers most Americans never see: the hospital, the insurance company, and a middleman called a PBM. Each one takes its cut, and every dollar they take traces back to one structural decision. The United States chose to let private companies run healthcare for profit. Let's start with what happens when you walk into a hospital. The first thing that hits you isn't the diagnosis, it's the price. An emergency room visit costs between $1,200 and $3,500. That's before anything serious happens. In Florida, the average is $33.94. In California, $32.38. In New Jersey, $33.77. And the prices inside have nothing to do with what things actually cost. Every hospital in America has an internal document called a charge master. It's a price list with thousands of items, but the prices aren't based on reality. A bag of saline costs about $1.07 to make. That's sterile salt water. On your bill, it shows up as $200 to $700. HCA Healthcare billed $87 for a saline flush that cost them 47 cents. That's an 18,000% markup. And it's not just saline. One patient paid $19,000 for a Remicade infusion. He switched hospitals, same drug. The new bill was $132,000, 7 times more for the exact same treatment. The same blood test can be $50 at one hospital, $400 at the one across the street. Same test, same equipment, different charge master. Federal law says hospitals have to publish these prices. Over 75% don't. The fine for hiding prices is smaller than the profit from keeping them hidden. But that's not the only way hospitals extract money. There's a federal program called 340B. It was created in the 90s. The idea was to let hospitals in low-income areas buy drugs at a steep discount. Those savings were supposed to reach patients. Here's what actually happened. Hospitals buy the drugs cheap through 340B, then they bill insurers and patients the full retail price. They pocket the difference. An IQVA analysis found this overcharged public employee health plans by $1.8 billion in 1 year. The whole program hit $81.4 billion in drug purchases. A discount program became a hospital profit engine. So that's layer one. Secret prices, 1,000% markups, a discount program flipped into a revenue stream. And all of it exists because American hospitals are private businesses. They set their own prices. No government agency tells them what to charge. That's what privatized healthcare looks like at the hospital level. But the hospital is just the first cut. The insurance company is the second.
You'd think insurers fight against hospital prices. That's what you're paying premiums for. But hospitals and insurers aren't fighting each other. They're feeding each other. The hospital sets a high charge master price. The insurer negotiates it down. Then the insurer tells you they saved you thousands, but the negotiated price is still way above actual cost. Both sides win. The hospital gets paid above cost, the insurer looks like it's working for you, and you pay the premium, the deductible, and the copay, unless they deny your claim entirely. On ACA marketplace plans, the denial rate for in-network claims is about 20%, 1 out of 5. For prescriptions, denials jumped 25% between 2016 and 2023. Most people who get denied don't appeal. The insurer counts on that. If you give up, they save money. If you fight and win, they just pay what they owed. No penalty either way. Now, here's how this got built. Insurance in America didn't start as a profit machine. In 1929, school teachers in Dallas paid 50 cents a month to Baylor Hospital. That became Blue Cross. It was non-profit. 95 cents of every premium dollar went to patient care. During World War II, the government froze wages. Companies started offering health insurance as a tax-free perk. The war ended, the tax break stayed. Insurance got locked to your job. No other wealthy country did this, but the real turn came in 1971. President Nixon sat in the Oval Office with his advisor John Ehrlichman. The conversation was recorded. Ehrlichman said, "All the incentives are toward less medical care, because the less care they give them, the more money they make." Nixon said, "Fine." In 1973, the HMO Act sent federal money to for-profit insurers. The government started subsidizing a business model built on giving less care. Then in 1994, Blue Cross plans started converting to for-profit corporations. Blue Cross of California became WellPoint, then Anthem. Wall Street moved in. The results show up in the numbers. In 1993, 95 cents of every premium dollar went to care. By 2010, the Blue Cross plan in Texas spent 64 cents. The rest went to executive pay, shareholder dividends, marketing, and lobbying. Insurer revenue has almost tripled in a decade. In 2014, top insurers brought in $511 billion. By 2024, $1.517 trillion. After the ACA passed, the top 5 insurers saw profits jump 230%. Today, the 7 largest insurers pull in $1.7 trillion in revenue, $54 billion in profit, while covering 10 million fewer people than the year before. United Health Group's CEO made $26.3 million in 2024, 348 times what his average employee earns. And the cost keeps climbing on your end, too. Medical care prices rose 121.7% since 2000. Everything else rose 86%. Healthcare inflation has beaten general inflation every year for 25 years, 3.24% versus 2.52%. Employer health insurance premiums jumped 342% between 1999 and 2024. Your groceries didn't go up 342%, your rent didn't, your health insurance did. And in 2026, ACA subsidies expired. Premiums are projected to jump 114%. 4.8 million Americans are expected to lose coverage. 1.5 million already dropped out.
That's layer 2. Insurers collect more, cover fewer people, deny 1 in 5 claims, and run a model that was designed in Nixon's Oval Office to profit from less care. All of it made possible because American health insurance is run by private corporations answering to shareholders, not patients. But there's a third layer, and this is the one almost nobody knows about. You leave the hospital with a prescription. You go to the pharmacy. The pharmacist tells you it's $280 for a 30-day supply. You have insurance. You've been paying premiums every month. The price wasn't set by the drug company. It wasn't set by your doctor. It wasn't set by the pharmacist. It was set by a pharmacy benefit manager, a PBM. 3 PBMs control 80% of every prescription filled in America: CVS Caremark, Express Scripts, Optum Rx. CVS Caremark is part of CVS Health. CVS Health also owns Aetna Insurance and CVS Pharmacies. Express Scripts is owned by Cigna. Optum Rx is owned by United Health Group. The company that sells you insurance also decides your drug price. It negotiates the deal. It runs the pharmacy that fills your prescription. It controls every step. In January 2025, the FTC found these 3 PBMs marked up 51 specialty generic drugs by thousands of %. Cancer treatments, HIV medication, immunosuppressants. They pulled $7.3 billion from those markups over 5 years. They also use spread pricing. They charge insurers one price, they pay the pharmacy less, they keep the gap. That added another $1.4 billion. The best example is insulin. $99 per unit in the US, under $9 everywhere else in the developed world. Same molecule, same formula, 10 times the price.
In 2003, Congress passed the Medicare Modernization Act. It banned Medicare from negotiating drug prices, the single largest drug buyer in America legally forbidden from asking for a discount. 952 lobbyists worked that bill. The pharmaceutical industry spent $32.3 million. Several members of Congress who wrote the law later became pharma lobbyists. The ban held for almost 20 years. In 2022, Congress allowed Medicare to negotiate on 10 drugs, 10 out of thousands. Those new prices didn't fully kick in until 2026. A USC study found that separating PBM profits from drug prices would save about $100 billion a year. $100 billion, taken by 3 companies that don't make a single pill. Meanwhile, pharmaceutical companies spent $11 billion in U.S. advertising in 2024. The U.S. and New Zealand are the only 2 countries that let drug companies advertise directly to consumers on TV. That's Layer 3. PBMs owned by insurers control 80% of the drug market. Congress was paid to block price negotiation, and the whole structure is privately owned and privately run, just like the hospitals and the insurers. 3 layers, all private, all built to extract profit at every step. Here's what that does to the people inside this system. America spends $14,885 per person per year on healthcare. Administration alone costs $1,078 per person. That's 5 times more than any other nation. Between 15 and 20 cents of every private insurance dollar goes to paperwork. Medicare does the same job for 2 cents.
82 million Americans have cut back on food to afford healthcare. 60% have skipped a hospital visit because of cost. 37% of insured people avoid the doctor when they're sick. They have insurance. They still can't afford to use it. 11% skip meals regularly to cover medical bills. 72 million adults carry medical debt right now. 2 out of 3 personal bankruptcies are caused by medical bills. Not bad investments, not overspending, getting sick. When insurance won't pay and savings run out, Americans go to GoFundMe. 1/3 of all campaigns on that platform are for medical bills. Over 250,000 medical fundraisers go up every year. GoFundMe's CEO said it himself. His website has become America's backup health insurance. Now, someone's going to say this is the price of having the best healthcare in the world. Here's what the data says. Americans spend 2.5 times more than other wealthy nations. Life expectancy is 79.3 years. That's the lowest among peer countries. South Korea spends 1/3 of what America spends. Their life expectancy is 83.5. Japan spends less than America. Their life expectancy is 84.2. The US doesn't have better outcomes, it has higher prices. So why doesn't it change? The healthcare industry spent $744 million in federal lobbying in 2024. More than oil, more than defense, more than tech. Pharma alone spent $391 million. Pharma hit $38 million in 2025, a record. Nearly 4 healthcare lobbyists for every member of Congress. 51.6% of them are former government officials. They wrote the rules, then they left. Now they get paid to protect the rules they wrote. Every time this system almost changed, lobbying stopped it. 1943, universal health insurance proposed. The American Medical Association killed it. 1971, Nixon picked profit over public care. 1993, Clinton tried universal coverage. The insurance industry spent tens of millions to shut it down. 2003, Medicare banned from negotiating drug prices. $32 million in pharma lobbying. 2026, ACA subsidies expired. Premiums doubled. 1.5 million dropped coverage. Every time, the money won. 70% of Americans say the system has major problems or is an outright crisis. That's Gallup, December 2025. It crosses every political line.
This isn't a left or right issue, it's a math issue. Now, here's the part that makes the math clear. Everything in this system, the secret pricing, the claim denials, the drug markups, the lobbying, exists because the United States chose to run healthcare through private companies whose job is to generate profit. South Korea made a different choice. The government runs a single national insurance system. It sets the prices. Hospitals don't make their own price lists. There are no PBMs in the middle. Insurers don't deny claims to protect margins. An appendectomy costs $10,000 to $40,000 in the US. In Seoul, at hospitals ranked among the best in the world, $10,000 to $21,000. Same medicine, same science, same century, a fraction of the cost. And South Koreans live 4 years longer. Not because their doctors are better, because their system wasn't built to profit off sick people. That's the difference one structural decision makes. In 1929, 50 cents a month could protect a school teacher from financial ruin. Almost 100 years later, the system built on that idea charges Americans $14,885 per person per year, and still sends 2 out of 3 bankruptcies through medical bills. And that $14,885, it's not safe in your bank account either. Next time, your retirement savings. Your 401k is being drained, and you don't even know by who.